Hi everyone, welcome to MD-VOD, your health live and on demand here on emPOWERme.tv. I'm Dr. John Kennedy, and today we're talking about addiction, which is a physical or mental dependence on a behavior like gambling, internet pornography, or a substance that makes a person feel powerless and totally out of control. The classic hallmarks of addiction include impaired control over a substance or behavior, preoccupation with a certain substance or behavior, continued use despite negative consequences, and total denial. Common addictions can include alcohol abuse, gambling, sex, prescription drugs, and street drugs like heroin, cocaine, and crystal meth. Each year, drug abuse and drug addiction costs employers over $22 billion in lost productivity time and another $15 billion in health insurance costs. And we know that 1 out of 10 people suffer from addiction. So the problem is huge and affects almost every family in America. Today, we're joined by addiction expert Dr. Cassidy Blair, who will help arm you with information about addiction to share with your loved ones and healthcare professionals. Dr. Blair and I will take a look at who's at risk, common signs and symptoms, how to make the diagnosis of addiction, and discuss treatments and therapies available. And finally, we'll talk about how insurance providers address the costs. Up next, to help us better understand addiction, we'll take a look at the anatomy involved and how our brain and bodies are affected by addiction. To have a thorough understanding of any disease, it really helps to know the anatomy. Today, we're learning about addiction. When we become addicted to a drug or behavior, there are actually changes that occur in our brain. These changes occur in the pleasure center, also known as the nucleus accumbens. Using drugs or partaking in certain behaviors like sex or gambling then leads to a release of feel-good chemicals known as endorphins and dopamine. When someone becomes addicted, they develop a dependence on the drug, so that it requires more and more of the drug over time to achieve this feeling to feel good. Once you're addicted, this cycle of using and requiring more and more of the drug or the behavior to feel right repeats itself. And then the drug or behavior becomes the most important thing in life, which can be devastating. To learn more about addiction and what you need to know about your loved ones, join us next with addiction expert Dr. Cassidy Blair. Welcome back to MD-VOD, where we're talking today about addiction, and here in the studio is addiction expert Dr. Cassidy Blair. Thanks so much for joining us, Dr. Blair.
Thank you so much for having me. It's a pleasure.
So what is addiction?
It's relying on mind-altering drugs or substance or a behavior that actually you need to have in order to experience certain pleasure. And most people nowadays rely on either alcohol or substance, prescription drugs. With the age of internet, we have cyber sex and gaming, or even social media obsession.
Wow. So it's not just drugs that we're addicted to. It can be behaviors like you mentioned. It can be internet porn. It can be gambling and other things. And you know, recently I heard you can actually be addicted to falling in love. Is that really true?
Yes, it's called love addiction. So a lot of people have a tendency to get into relationships and focus on that one person, and they experience the same withdrawal symptoms, the same tolerance.
Wow.
And all that is actually very, very similar to being addicted to drugs or alcohol, and you experience the same symptoms. It's true.
Wow. Wow, interesting. So our body changes, you know, to the behavior just like we would to a drug. On that note, what is the most common drug in America that we're addicted to, or one that causes the most problems?
It's alcohol, and it's most now very, very prevalent is prescription drugs. So people getting addicted to Vicodin, Soma, Norco, and other prescription drugs that they use for sometimes pain, and then they get addicted to that and can't stop using it.
Wow. So when someone comes to you as an addiction expert, what are some of the signs and symptoms that really tell you, hey, this person has a problem and they're addicted to this drug or behavior?
Oftentimes, actually, a lot of people come in and they focus on someone else in their lives. They say that someone is picking on me. They just try to play the victim card a lot. So they come in not focused on their own problems and issues. But when you really get down deep, you realize that these people are having a lot of tolerance. They're having a lot of withdrawal symptoms. They're not able to function at work. They're not able to function in relationships. They're having family conflicts and a lot of issues that interferes with their ability to do their job at work or whether go to school, maintain relationships. It creates a lot of problems.
So that's great advice. It sounds like people in your life, your family, your friends, can help make the diagnosis. Is that true? When you see that the drug or behavior is taking over their life and it's affecting their everyday activities, is that right?
It is, and a lot of times people have changes in sleep patterns. They're having a change in weight gain or weight loss. They're not able to show up for work. They're not able to really deal with their family members. So that's when a lot of family members can pick up on it and say, this is an issue. You never used to sleep this much. You never used to weigh this much. Or you're very angry and having angry outbursts and kind of not the same person you used to be. So the tolerance for other people and frustration tolerance is actually much lower.
Is there any one symptom or sign that might help you know that you're addicted to something?
Knowing that you really most often want to be alone and don't want to be around other people except the object that you're addicted to or the person that you're addicted to.
Wow.
And interestingly enough, a lot of people want to use something because they want to numb a feeling of being depressed, being anxious, or being lonely. And right after you use that object or being around that person, when you leave, you feel more of the depression, more of the anxiety, and feel even lonelier. So all the feelings you're trying to numb and avoid are the feelings you're left with even worse after you have used whatever it is that you were using or being around the person you were addicted to.
Well, so that's great advice. If you're feeling like you want to be alone more, to use or to do some certain behavior, that's a sign that you might be addicted. That's also a sign that I would imagine that family and friends would notice and probably bring your attention. I have a question. What's the difference? Because I drink coffee every day. I mean, I love the smell of it. I cannot complete sentences before I have it every day. What's the difference between being dependent on something and being addicted to something?
Dependence is usually when you actually have to arrange a lot of activities around that use. And you have to make sure that you avoid certain other activities in order to be able to have the time and the space to use something. And when actually your mood changes because of it, and if you don't have it, you experience having symptoms that you wouldn't ordinarily have if you weren't addicted to it.
So, and my next question is, can you have, and you may have mentioned this, can you have withdrawal symptoms from, let's say, gambling, if you stop just like you would from a narcotic drug?
Well, it's absolutely. Actually, there's many behaviors, gambling, sex, addiction, and many other behaviors that people find. Shopping online and social media obsession, those are all activities that people just cannot stop. And they need to increase that activity more and more in order to get certain desired effect. And without it, it becomes very sense of uneasiness.
So it's the same cycle of using and then abusing and becoming
100%.
dependent and then using again to feel that feeling.
Yeah.
What are some of the most effective therapies for addiction today?
Mostly it's cognitive behavioral therapy, but that is not across the board, of course, for most drugs, for most alcoholics and people who use a lot of drugs. They have to go through a detox program first, under the supervision of a psychiatrist or an internist, make sure that they detox. For a lot of people who've been using some drugs, they have to go through methadone, and they can't just go cold turkey, but some drugs you can, some you cannot. And in a detox program, they make sure that you're titrated down or tapered down in a way that's not life-threatening.
Okay.
So, but afterwards, working with therapy, psychotherapists using cognitive behavioral therapy most often is the most helpful because it deals with the adaptive, the maladaptive thinking, maladaptive feelings, and maladaptive behaviors.
Those
and it goes
feelings
to
of
the
loneliness
roots.
and wanting to
Right.
use alone and all
Exactly.
that. Oh, interesting.
Exactly.
So, I've heard that there are a lot of, government funded agencies and other programs that can help people that have addiction. Are there anything that you can recommend to our audience that might help them?
Just call up your insurance company, find out from them if they have any benefits for you. Most insurance companies nowadays do provide some kind of benefits. If not, there are many free clinics actually that do offer that. You can definitely seek help. It is available, and you have to just reach out and take the first step to do it.
Well, that's great advice. And are there any support groups that people might find on the internet that might help them?
Absolutely. For alcoholics, usually people having issue with alcohol is AA, and people having problems with cocaine, there's CODA, and there are Gambling Anonymous, all sorts of different groups, support groups for people. The 12-step, based on the same 12-step of AA, there's similar support groups that they have to obviously find out about, and they can go online and Google that information. The other thing that they can do is there's support groups usually that a lot of clinics or hospitals have. They have outpatient programs that they can go to, and that's very helpful in conjunction with psychotherapy, in conjunction with being under supervision of a psychiatrist for medication management and adjustment. Families and friends of people with drug or alcohol addiction can also go to Al-Anon, which is dealing with families who are having a problem with addiction of any kind. So that's also another support group based on the same 12-step program.
So that's great advice. Al-Anon and AA are both great resources for people with addiction or family members. So my final question is, in addition to the detox for people that are appropriate, let's say to narcotics or alcohol, the group therapy that you would recommend maybe later down the road, and the thing that you mentioned, the cognitive behavioral therapy or CBT, what's an example of cognitive behavioral therapy that you might use in somebody that was addicted to, let's say, internet porn or gambling or drugs?
Well, a lot of it, again, the root of it is maladaptive thinking. And so your thought is that you have to complete a certain behavior in order to feel better about yourself. And you get involved in those maladaptive behaviors and end up feeling really worse afterwards. So you deal with the roots of this thinking. And once you get to the root of it and see where they pick it up, a lot of it has environmental factors. You learn this from your parents or from family members you're around, that this is the norm and you have to engage in certain kind of behavior. But if you really think about all of that and you talk to the person coming to your office and you understand that this is what has been ingrained in them, and if you really go to the root of it and try to change that, you are able to really make headways.
Well, it's great. Last question. I know I keep saying that. It's so fascinating. If you have a family member, you mentioned, learning from your environment. If you have a family member that's addicted, does that increase your risk?
Yes, definitely environmental factors are important. If someone comes in and say, my dad has been using alcohol, my mom has been using alcohol, my brother is addicted to prescription drugs, obviously they have a lot of pressure at home already, not just peer pressure at school, but once you have it at home. The other factor is psychopathology also. If you have bipolar disorder, if you have any personality disorders, specifically antisocial, and borderline personality disorder, and anxiety or depression, those are psychopathologies that really contribute to the use even more so.
And I would imagine, kids today in high school, it seems like drugs are just all around us. Is that a factor? Is there more are there more drugs out there, or is it just that kids are learning more on the internet? What's that whole?
Well, unfortunately, these days there's many different components. I think one is that the stress has increased in families. Parents are not as present in their kids' life, and they're not aware because they have to deal with their job or careers a lot. And so when you're not as involved in your kids' life, it's hard to really know what they're doing. Kids also need someone to listen to them. They need someone to be able to get guidance and support. And a lot of kids feel neglected. And their way of getting that attention is to act out. And that acting out can come in the format of using a drug and substance just to maybe numb their own anxiety or their loneliness. And before you know, they can easily get hooked on it.
Wow, so that's interesting.
Yeah.
So in addition to the kids, all the peer pressure, the
Yeah.
academic pressure, the social pressures, there's this, just wanting to be acknowledged by their parents. That's great advice. I want to thank you. We could talk all day about this subject. It's fascinating. Thank you so much to Cassidy Blair for talking about the problem, addiction, the diagnosis, the treatment, and even some of the ways that we can prevent it. Join us next when up on An Apple a Day, we'll talk about ways that you can deal with a loved one that may be addicted. We're back with An Apple a Day and common sense tips to help loved ones deal with those living with addiction. Relapse is an unfortunate but common occurrence, and seeing a loved one return to drugs or alcohol after addiction treatment can be devastating to family and friends. And you may feel that all your efforts for this person were meaningless. So here are some important points that'll help you deal with a loved one if they relapse. First, stand firm and hold them accountable for the recovery from their relapse. And try not to make excuses for the addict because it's still their problem and it's not yours. And make sure you encourage them to talk to their counselor or sponsor and go to an addiction support group meeting. And be sure to stay on top of the latest news about addiction research at cdc.gov, because the more you know, the more successful you'll be in dealing with the loved one that's struggling with addiction. I want to thank you very much for joining us, and I hope you found this information about addiction helpful. I'm Dr. John Kennedy, and you're watching MD-VOD, Your Health Live and On Demand, here on emPOWERme.tv. And don't forget to like us on Facebook, follow us on Twitter, and share us with your family and friends. And for any episodes you might have missed, they're now available on demand at emPOWERme.tv's website and the YouTube channel. And as always, be sure to leave us your comments and questions so that we can better help you cope with your disease. We'll see you next time on MD-VOD.